Hi everyone, my name is Sherlyn, working in Global College of Nursing. In this video, I am going to talk about oral cancer. Definition of oral cancer. Oral cancer is the uncontrollable or abnormal growth of cells that invade and cause damage to surrounding tissues of the oral cavity. This cancer can develop anywhere in the oral cavity. This is one of the life-threatening diseases. Next, the causes of oral cancer. Smokeless and smoking tobacco use. People are having the addictive habit of cigarette smoking, either using by the windpipe. Next one is areca nut chewing. It is in the sense betel nut chewing, drinking of excessive alcohol. Next one is poor nutrition. The food items what we consume, if it is having a lack of vitamins, lack of minerals, as well as lack of iron and folic acid. Example, eating of junk food items, or the people's consuming more processed food items, that will also cause for oral cancer. Next one is human papilloma virus. The people are getting infection with the human papilloma virus. The infections are it is developed in the oral cavity, that may be the developing oral cancer. Next one is the genetic factor. Genetic factors in the sense the hereditary factor. The family members, those who have a blood-borne relatives, these are having the problem of this oral cancer, that may be also one of the chance. Next one is the chronic trauma. People are getting injury or infections in the oral cavity. The wound is not healed by more than 16 days after taking treatment. Then it will be going to develop abnormal mutation in the DNA cells, then growing of abnormal cells in the oral cavity. Risk factors for oral cancer. Cigarette smoking, drinking excessive alcohol, then betel chewing. It's also the risk factor. The reason is compared to the normal people's getting oral cancer, those who have this addictive habits of this betel chewing or smoking or excessive drinking of alcohol, those peoples are 6 times higher than the normal peoples. Next one is exposure of sunlight. Those who are working in the sunlight, they are receiving more ultraviolet radiation, that will be going to create abnormal mutation in the DNA cells, developing a cancer cells. Next one is exposure of chemicals. Examples asbestos as well as in the sulfuric acid. Those who have a chance to receive more in their bodies, that will also one of the reason. Next one is human papilloma virus, that I have explained in the causes. Also weaken immunity due to certain medication. Examples, those who are receiving a chemotherapy as well as the radiation therapy medications, sir, it will be going to affect our immune system, so it will be also going to develop abnormal mutation of DNA cells. Signs and symptoms of oral cancer. Signs and symptoms, the white patches or red patches, it's developed on the lips, gum, tongue, or in the buccal mucosa. If it is white patches, it is developed, the term it is called as leukoplakia. Then painful or a difficulty in swallowing while they are eating, then difficulty in speaking. Other than this, hoarseness of voice. Sometimes they may lose the teeth without significance of reasons. Developing lumps in the oral cavity, burning sensation, and ulcer formations developing in the oral mucosa. Numbness or pain in the area where the abnormal growth of cells are it is developed. Next one is bleeding in the mouth. Next one is lump which can be felt in the side of the mouth or in the side of the neck. Pain or stiffness, it is present in the jaw. Next one is sore throat that does not heal. Next one is the diagnostic evaluation of oral cancer. First one is the physical examination. In this physical examination, it is helpful to rule out what are the signs and symptoms we have seen to the patient, that all the symptoms it will be happen to the patient. Next, biopsy. After doing the physical assessment, And of oral cavity, the physician found any suspicious changes in the oral region. The physician remove small pieces of tissues, then sending for the laboratory to identify the normal cells or an abnormal growth of cells. The physicians using a scalpel to cut away a sample of tissues. That term it is called as a excisional biopsy. If they are using a needle to remove a sample from the site, that term it is called as a fine needle aspiration. Endoscopic examination. This will helpful to identify how the tumor cells are it is spread from the mouth to the throat. Next one is the imaging techniques. The X-ray, CT scan, MRI as well as PET scan. It's helpful to identify the stages of the tumors, and also it will helpful to the physician to choose the treatment options and helpful to predict the diagnosis. Then the treatment choice for oral cancer. The treatment it is depends upon the location as well as the stages of the cancer, and the physician as well as the particular person choice. The surgical management. First one is resectional surgery. If the tumor size is very small and the tumors are it is developed only in the margin of the tissues, they will go for the resection surgery. The physician will going to cut the margin of the tumor along with